Dr. Dominic here at Elite Facial Plastic Surgery, and I want to talk to you about rhinoplasty pertaining to thick versus thin skin. They're two different things that you got to handle, and the reason why is thin skin, logically, is going to show the cartilage a lot easier, whereas thicker skin will not. Now, normally with a thick-skinned individual, what you're trying to do is provide more definition to that tip. You want that tip to show more. So having thicker skin can be a bit of a challenge. So in those situations, and again, not everybody's cookie cutter, but normally what you're trying to do is refine the cartilage underneath. And sometimes the cartilage is not strong enough to hold the skin envelope. And so you have to put support, for instance, what's called a strut graft, to kind of push the cartilage up and to provide more tension on the skin so things show better and you have a better light reflex. Now, in some patients, what you end up having to do is you got to basically hold people's hands and tell them just to give it time. The nose, with most rhinoplasties, is going to take 9, sometimes 12 months to fully settle. With patients who have thick skin, you can certainly bet on getting close to the 12-month period because it takes time for that soft tissue and swelling to settle out. You think of this, the thicker the skin, the more likelihood it is it's going to absorb fluid. Now, there are other things you can do as you're recovering. There have been some patients, who have seen a dermatologist to kind of help out with the thicker pore on the skin. And in that case, I do send them to a dermatologist to get their opinion. But as a general rule of thumb, thick skin patients are going to take a bit longer to heal just because of swelling. So if you have any questions about rhinoplasty, you want to leave some comments or you have some questions about your nose, feel free to do so. We look forward to taking care of you.